good evening. Thanks for watching this video. If you don't know me, my name is Neil Davidson, 52 years old, from South Norfolk in the UK. I was diagnosed with prostate cancer last December, and had the operation excuse me, had the operation in April, had the prostatectomy. Just a massive thank you for everybody who's watched and subscribed to my channel. One of my videos eventually has quietened down, and we reached 54,000 views, and from an initial 100 subs, absolutely unbelievable. And many thanks to everybody who watched that, who liked, shared it, and I say those people who subscribed to me and went back to look at my journey from the start. Just a massive thank you. I think that I've had my 15 minutes of fame. So I sent another video out a couple of weeks after where it only reached 2,000 views, which to me matters nothing. I haven't hit 1,000 subscribers on YouTube, so I'm not earning any money, so it doesn't matter to me how many views, as long as it reaches that one extra person who we can help and say to aid recovery. So I'm more than happy if I get one view or 100,000. It doesn't matter to me. So again, I'm on 573 subscribers, so I would love for anybody just to subscribe to me if they can and go back and watch my journey through how I got diagnosed with the cancer. But it's hard for me to keep these videos going now because it's a subject that only a very small percentage of the people on the globe are interested in. So I want to keep it going, and so I've got a good passion, interest in it. And so what I'm going to do today, out of the 54,000 views I got about 550 comments, and I was asked a lot of questions. I think a lot of people said I brought a lot of big worded hospital terms into plain English. They were asking me questions, so I'm going to try and do like a question and answer video. 15-20 questions of the main questions you may need to know about prostate cancer. So question number one: is it true only the older generation can get prostate cancer? Well, the simple answer is no. You can actually get it at any age. I'm 52, 51 when I was diagnosed. Most people think it is an old person, you know, mid-70s, early 70s disease, but it's not. Symptoms are rare when you're younger, and the stats say that 1 in 10% of people are actually 55 and younger. And like myself, the earlier you can catch it, the better chance you have with the treatment and survival. I will just say I'm not medically trained. All the questions I've gained from Google, so it's probably a US based and biased answers. So again, I've tried to research what I can. So if anybody picks up on anything, try not to comment in bad, because I'm only trying to help, and so I'll pick the answers up from Google. Question 2: if you have a PSA over 4, does this mean you have cancer? Again, definitely not. 4 is just a guideline. 0 to 4 is okay. Anything over 4 is just like an engine light on your car. What it basically mean, there could be an issue somewhere else down there. If you have a reading of PSA 7, it could mean an enlarged prostate, it could mean prostatitis, UTI, urine infection, it could mean inflammation. I've just had a guy from work who's had a PSA of 10 for the last 3 years. He thought he'd had prostate cancer, but with biopsies it came back it wasn't. It was just an enlarged prostate. So he's very happy, and as I say, it just shows you there's something going on down there. It's just the quicker you can find and have a test, the better chance you are to get treated better. My PSA was 5.6 to 6, and with that I had 5 tumours, and as I say, I've had the all clear for the next 6 months, so you know, all is good for me. So definitely not. I say 4 is just a guideline, and the PSA is the best test they can do for that. Question 3: what are the signs of prostate cancer? Some of the main symptoms are going to the toilet frequently, start and stopping when you're having a pee, weak flow, burning sensation, whether there's blood present in there. Some people say pains in the lower back and the hips and the legs, and also loss of bowel and bladder control. For myself, I had a lower back pain, but that got diagnosed as pretty much something else. But I know some people who have just had a niggle pain down the bottom of the back, and that has contributed. Question 4: is it true that black coloured males are more at risk to catch prostate cancer than whites? Yes, it is true. Stats says 1 in 4 are more at risk, and 1 in 8 for whites. The African Americans are more at risk, and the nation with the least risk are the Asians. So whether that's down to diet or something in their genealogy, I'm not sure. Question 5: what does PSA stand for? PSA stands for prostate specific antigen, and it's just taken with a regular blood test, which you can have at your local GP surgery. You would have to ask for this. They're not too willing to just test everyone's PSA. So if you've got a main symptom like going to the toilet at 1 o'clock, 3 o'clock, 5 o'clock in the morning, go to your local doctors, get one done. So the quicker you get it done, the quicker you get tested, the earlier signs, the easier it is to treat. Question 6: is prostate cancer hereditary? Studies show yes, it is. If you've had blood relatives that are very, very close to you, like your father or your brother, you are more than double at risk to catch it. Question 7: why does it take long for symptoms to show with men with prostate cancer? Again, the study shows that the prostate cancer is a very, very slow growing within the men. Within the prostate itself, a lot of people say you'll probably die with it rather than of it. But it all depends where the tumours are and how close they are to escaping the prostate. I had one right on the edge, and I was very lucky that we caught it, because it starts going to the lymph nodes and the bones. Then it's just difficult to treat. So I got mine very, very, very early on a very random blood test. And again, if people subscribe to me and go back and watch my videos, you'll see my journey, and you'll see how lucky I was by catching it very, very early. Do you feel ill with prostate cancer? If your prostate cancer has spread and you have symptoms, and they say yes, you would feel ill. You'd be tired, fatigue, bone pains. You're just feeling generally unwell. But again, with myself, I had 5 tumours. I didn't feel anything whatsoever. I had no pain, nothing down there whatsoever. So again, my only symptom was I went to the toilet at 3 o'clock in the morning, and then 80% of men over 40 do that anyhow. And would you go to the doctors and ask for a PSA test because you got up at 3 o'clock in the morning? No, you wouldn't. So I was very, very lucky, very, very lucky. I had a random blood test in Latvia, which cost me €20, and we caught it from there. So I advise any person who has a chance to go and get a PSA test, whether you've got symptoms or not, and you're over the age of say 45, just go and get it done. There are so many pop-up centres at rugby clubs and car parks, and these centres where you can just get it done. I know there's a charity in the UK called the Graham Fulford charity, where I believe if you go onto their website, you can actually see where they're doing these tests, and it's going to cost you £20-25, so absolutely fantastic. If you were to get it done privately, you're looking over £100 plus. You can get it done at the doctor's, but they will ask you what symptoms you've got, and if they think that you aren't warranted, then they won't do it. So if you see any these charity days for PSA testing, please get it done. And I'm so grateful that I went to Latvia and got mine done. Mine cost 20 quid, and a year later I've had the operation, and we're lucky that we found it. Question 10, can a man be okay without a prostate? Yes, absolutely. People without prostates can lead a full, healthy life. So yeah, all good. I'm fit, well, and I'm back to 100% to be honest. Question 11, what is the finger test for the prostate at the doctor's? This is called a DRE. Digital rectal exam. You'd go to the doctors, that'd be the first thing. You'd go to the doctors and they would put finger up your rectum. It's not pleasant, but it's only 4 or 5 seconds, and then they can feel for the first sign of any lumps or nodules on your prostate, and if they feel something, any hard bumps, they will then send you for an MRI within sort of 14 days in the UK, and then your journey starts from there. So the GP would be the first port of call where you would go to. It's called a DRE, digital rectal exam. It takes 4 or 5 seconds. It's unpleasant, but it's not a big problem. Question 12. Do I need a catheter fitted after the operation? Yes, you do. Yeah. Again, this differs in every country. In the UK, we normally have 2 weeks, so 12 to 14 days. Myself, I was 15 days. I know a lot of people in the US say there's 7 to 9 days. Again, the catheter is there to help you. It's unpleasant. You learn to live with it. You have to live with it, and it's interesting. That's all I'll say. It's interesting, but it's there to do a job. It helps you heal, and it's looking back at it. It was certainly an experience, but certainly didn't hurt. But it was just uncomfortable. But yes, you do. At least a week, but in some cases in the UK, you will have it for 2 weeks. What's the #1 cancer fighting food? Well, like everybody, when you look at these diets and all that, fruits and vegetables, berries, broccoli, tomatoes, walnuts, grapes, and pretty much any veg or fruit is very, very healthy for you. So I'd stick to that to maintain a balanced, healthy diet. Is a doctor's the only place where I can get a PSA test done? Well, as we just mentioned before, no, you can get it done privately. You can go to a local practice who do it, and they will charge you £100 plus. Again, I was lucky. I was charged €20 for a full blood test in Latvia. And again, as I mentioned before, there was an organisation, a charity called the Graham Fulford, who do pop up, especially down the south. They do have a website where they've got a list of all the different places they go to. Again, there's a lot of rugby clubs they go to and things like that. So you can log on to the charity and you can see where they are being done. And there are some places they go to are private events, but sometimes there's a lot of spaces open. You just register with them and just sign up, register, pay £20-25, and then go along, take a blood test, and they'll let you know what's going on. So thoroughly do recommend something like that. Question 14, what treatments are available? Well, the main ones are the prostatectomy, which is the removal done by the DaVinci robotic. You can have a proton beam radiation and brachytherapy. Brachytherapy are radiation seeds they plant into the prostate, which over the course of time should shrink and reduce the tumours within the prostate. Obviously the beam radiation, you probably have sort of 30 sessions of that, which is like you go into like an MRI tunnel with the beam for about, I'm not sure to be honest, maybe 10-20 minutes. and that goes that way. But I decided to go with the prostatectomy because of my age, 52. But the prostatectomy is not for every person. The older you are, they probably wouldn't put you through a sort of surgery. They'll probably go with a hormone therapy injection, or you say brachytherapy is very, very common. An HDR, which is a high dose, or LDR, which is a low dose. So there are different treatments. There are other things called focal therapy, which they can either freeze it off or heat it off. But in the UK, it's not that common on our NHS. You would have to go private, I believe. There are some organisations who probably do it, but you'd have to go private and have that done. But it's very new, so they haven't got the results for that. I did ask for it when I had my consultation with the surgeon, but he said it's something they don't do at the Norwich Hospital, so we ruled that one out. So I went with the prostatectomy. 52 years old, I thought it was a better chance for me for recovery, which again I'm 100% fine now, and I'm glad I took the prostatectomy. Question 15: what's a Gleason score? A Gleason score is given to you after you are diagnosed after the biopsies. The lowest score you can get is a 3+3, which they would probably keep you on active surveillance. A 3+4 and a 4+3 and a 4+4 and a 5+4, which means there are signs there of it's growing. I don't really want to go into it now, but I was a 3+4 and a 4+3, which means it's starting to grow and move around the prostate. 4+3 and 3+4, you probably won't be on active surveillance. They will probably treat it somehow. 3+3 in active surveillance, they'll keep an eye on it. They'll probably say the 3+3s aren't growing that quick, and again, you'll probably live a long time with a 3+3, and you'd probably just have a blood test every 3 to 6 months. But a 3+4 and a 4+3, which means there's two different types of cell in there. A 3+4 just means there's more 3s than there are 4s. 3 not being so bad, 4 being slightly aggressive. 4+3 is again slightly more 4s and 3s. It might be 75-25 split. I have done a video about the Gleason scores in my previous ones, so it goes into a little bit more depth. But 3+4 and a 4+3, you'd probably get treated with that. 16. How long does the DaVinci robotic prostatectomy operation take? It's a major surgery, and I went in at 7 o'clock in the morning, and they booked you in. My operation wasn't until the afternoon. I went down at 1 o'clock. The operation took 3 to 4 hours. You come back into recovery, and I came back on the ward 5:30, to be honest. I don't know why it took so long, but it did. Then you're sort of in the ward overnight. They encourage you to walk around, drink plenty, and more often than not, you are released the next day. So it all depends whether the blood results are okay and you're feeling okay. I had a problem with my catheter. It got blocked a few times because I probably wasn't drinking enough, and so I had to stay for 2 or 3 nights. But generally it is the next day, so you're only overnight in the UK. It may differ in the US, but in the UK they like to kick you out after a day, ready for the next person. I had 6 people on my ward, 4 went home the next day and 2 others stayed in. So it is major surgery. Again, it goes on to the next one. Is the prostatectomy a major surgery? Yes, it is. It is. They say it's not suitable for the older generation. They would probably be treated some different way with a brachytherapy or the therapy jab, the injection, or and the surgeon said to me, due to your age, that the prostatectomy is certainly the best way to go forward. Last question. Just want to try and keep it a 20-minute video. How painful is the removal of the prostate? It's not as bad as you think, to be honest. Yes, you will have 6 wounds in your abdomen, and yes, they're going to be sore, but painkillers, painkillers they give you from the hospital should treat that. As long as you do your exercises, just walking around. I know the CO2 gets trapped within the body, and a lot of people take a while to get rid of all that. The catheter is a bit uncomfortable for 2 weeks. It doesn't hurt. In the meantime, the wounds are healing. The only one that didn't heal for me was where they put the drain, the Jackson Pratt drain that come out there. That took a little while to heal, to be honest. I've got an infection in there, but with antibiotics from the doctors, that soon cleared that up. So that took probably 6 to 7 weeks to clear that one up. But the other wounds healed up after 2 or 3 weeks. Say in the UK, they'll put glue on them, and they just sort of like heal and don't get infected. And also the glue just falls off, and by that time the scar is healed and just sort of fades away. So again, we're all back to normal. We're back to work after a month, and we're doing good. Incontinence is 100%. No leakage whatsoever. No pads. Yes, we used a pad for maybe a month, but that was just in case, because I had a few infections and I just couldn't trust it. So as soon as I was back to work after 4 weeks, nope, nothing at all. All fine. So many thanks for watching. If you could like and share this. So I know I had over 1,000 likes on my 54,000 view one, and I think people shared it as well. And that's probably why it done so well around the globe. I had people from Venezuela, New Zealand, Norway, Sweden, India, Spain, US, Canada, you name it. Unbelievable comments. And I'd love for this video, or one more video, to try and go around the globe. As I say, I'm on 573 subscribers. Love to get to 1,000, but I know it's not going to happen. But it doesn't matter to me. I'm not earning nothing from it. It's just a buzz I've had, and I'm just so grateful with the comments I've had from people around the world saying thank you, to try and break this down and talk about it. So I'd love to continue doing these videos. It's something I have got a passion for, but the ideas are running out. But we're going to try and just do some once a month, and just a few updates where we go. I'm going to do one next month. I'm going back to Latvia in mid-August, and I want to try and do a video of where I actually got found, go to the surgery and try and film in there. But we'll see. They might not let me go in there, but I'm going to try and do a little video from there. So thanks very much for watching. I know I've waffled on a bit much. It's 22 minutes now. So again, thanks very much. So I hope you enjoy these videos. I try and break it down as best I can, and I know it's a big subject, especially those people who have just been diagnosed. So if you do like it, again, please like it, subscribe to me, have a look at my journey. And it's not all bad news. We all think the word prostate cancer is bad. In some cases, it can be, but in my case, I caught it early, very early, and we got away with it, touch wood, for a little while. Got another blood test in another 3 months' time with the NHS, and so I've had my last result, which was a less than 0.01 undetected. So far it's all good. I'm feeling good, and little by little we're getting there. So thanks very much again, and like, subscribe and share again. Thank you very much for watching.